If you've planned out a cesarean section, or C-section, in advance, you might be wondering what you need to do to make sure that you're ready for the big day. The idea of preparing for such a major event can be intimidating. But most women who plan for their C-section ahead of time end up realizing that the procedure itself is not as terrifying as they may have initially believed. Schedule early. Schedule your procedure for as early in the day as possible. Most doctors prohibit patients from eating for 8 hours prior to surgery. So having an early appointment will reduce hunger pains throughout the day. Having a morning procedure will also reduce the anxiety that builds up as the day wears on. And it will increase your chances of being taken on time. Talk to an anesthesiologist. There are 3 forms of anesthesia that can be used during a C-section. Discuss the options with an anesthesiologist and your doctor at the hospital to learn about each form in depth. Once you figure out which choice you want, include this information in your birth plan. General anesthesia is sometimes used and will also be used if the epidural does not work well or for other medical reasons. Spinal block anesthesia is one of the most common. The medication will work within minutes, and the mother will not be able to feel anything from her waist down once it takes effect. It is given in a single dose and takes a long time to wear off. Epidural anesthesia is also another common choice. A catheter is placed in the spinal cord and a constant flow of pain medication is pumped into your body. The medicine takes about 90 minutes to kick in, but it wears off shortly after the catheter is removed. Get tested. Your doctor may recommend a course of blood tests, urine tests, and other medical exams shortly before your scheduled C-section. These tests will reveal crucial information about your health and your baby's health, thereby allowing the doctors to prepare for any potential complications as needed. Wax or shave yourself. We're not talking about a full-on Brazilian bikini wax prior to surgery, but feel free if that is your thing. But shaving or waxing the top 1 to 2 inches of hair on your pubic bone prior to arriving at the hospital will eliminate the need for the nurses to do so with their disposable razors. Don't eat solid foods. The American College of Obstetricians and Gynecologists, or ACOG, talks about what to eat before C-section. ACOG recommends that women undergoing a planned C-section not eat solid foods 6 to 8 hours prior to the procedure. But they suggest that most women can drink moderate amounts of clear liquids up to 2 hours before receiving anesthesia. Not all hospitals or care providers follow these recommendations. So check with yours 2 to 3 days beforehand so that you can follow their guidelines. Most doctors prohibit patients from eating for 8 hours prior to surgery. Clear out your bowels. Clearing out your bowels, either by enema or through taking a laxative prior to the surgery, will make recovery and your first bowel movement much easier after the procedure. Pack your bags. Pack weeks in advance. Even if you schedule your C-section for a specific day, there is still a chance that you could go into labor before your intended delivery date. Know what your baby will need. Aside from your needs, you should also pack anything you know you will need to have for your newborn.